This is LBC from Global, leading Britain's conversation with Andrew Castle. Call 0345 6060 973. Text 84850. Tweet at LBC.
And a very good morning to you, 4 minutes past 9. It's a Wednesday morning, the 28th of December. I'm still jolly wound up about parking charges, and so are you. I'll get your calls in a few minutes' time. Experts are warning middle-aged people in England face a health crisis because of unhealthy lifestyles. Public Health England say desk jobs, fast food and the daily grind are taking their toll. 8 in every 10 people, just over, aged 40 to 60, right in the middle, in England, are overweight, drink too much, or get too little exercise. How many of those three did you tick? So how can we actually fight this? We are talking about our inactivity. We've got to put it right. 0345 6060 973. Well, this is an absolute beauty, isn't it? Because, I mean, it starts in school. Right, firstly, exercise starts with personal responsibility. You've got to look after yourself. So for me personally, this has been my living. This has been my profession. This is what I did. Thought about my body, my physical skills, because I was a sportsman for years. So, you know, you might say, well, it's easy for you to say. Well, it wasn't easy for me to say. I had to work my backside off from the age of 11. About physical exercise, understanding what goes in and understanding what comes out in terms of exercise, in terms of energy, in terms of function. So listen very carefully to this. And I know it gets really, really complicated, but at the end of the day, this is about personal responsibility, and it's about what you put in and what goes out. Okay, that's the weight thing. Now, there's all sorts of mental issues around this, and I'd be perfectly happy to explore all of them with you. It's 0345 6060 973. Goodness knows the relationship that we have in this country and in the West with food is a complicated one. I get that. You can give me a call. You can share everything you like with me. But the bottom line is, if you put too much in and not enough goes out, you're going to get bigger. Similarly, if you put too much out and you don't put enough in, you're going to get thinner. So let's just remember that before we get bombarded with a whole lot of nonsense about how if, you know, you distill the sugar of a glacial snail and you add it to a little bit of this. Gimmicks and gimmicks again. Okay, it is much easier than you think. There are all sorts of people out there, a fool and their money are easily parted, who will sell you quick and easy solutions to this. So that's so personal responsibility. Too much in, not enough out, you get bigger. So that's where I'm starting from. It's not school, it's not anything. It's your responsibility to look after yourself. We are a nation who have become devoid of understanding about our physicality. We don't live physical lives like we used to. We don't work the land. We end up in a car. We end up sitting at a desk going tap, 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 when we should be being physical. So that's what's happening. It's only 100 years ago we didn't even have cars. Do you see what I mean? So we've become sedentary, and there are problems. An analysis of national data by Public Health England reveals that 80% of men and 79% of women in middle age are either overweight or obese. 25 years ago, you would not see the amount of people waddling down the street that you do now. You know we are storing up problems. What can we do about it? Let's try and address the issue. Dr. Chinadore Raj, consultant physician at the London Obesity Clinic and director of Simply Weight, a weight loss company, joins us. And so does Nicci Roscoe, confidence and lifestyle coach and fitness advocate, which sounds great. We'll discuss it. Classic week for this, by the way, between Christmas and New Year. Will we make you feel guilty? Will we shame you into exercise? Oh, yes. Let's get evangelical. Dr. Raj, if I could start with you this morning. You're in a good business.
Well, I'm in the business to help the country out. Yes, thank you. Good morning.
Good morning to you. What do you suggest when people come to you? How do you first make an assessment of people's needs?
Right. I'm basically an endocrinologist, expert in endocrine or hormones, but I specialize in bariatric medicine, which is obesity. Now, you said about in and out, food in and out. But the thing is, it's not rocket science. Everyone knows that if you eat too much, exercise less, you're going to put on weight. But the problem is, why do people eat more? That is the question.
Well, that's the interesting relationship with food, isn't it, that we seem to have developed?
Absolutely. We have twisted the neurohormonal hunger for food for survival into pleasure, and that is the problem. The high energy food is converted to pleasure. We eat for pleasure. We don't eat for anything else. So when you're stressed, we need pleasure. We go for food. So people are not daft. Everyone knows that you got to eat less and exercise more. But there's more to it. That's what public health needs to address.
Oh, that's very interesting. So you've gone straight for the mental side of things, haven't you, Dr. Raj? Straight for the mental.
Absolutely, yeah. Absolutely, a neurohormonal. That's what I believe in. I don't blame my patients. I empathize with them.
Yes, no, I completely understand. Well, I'm sure you're sending out a message which people will relate to. 0345 6060 973. How much validity do you hear in that argument? Back to you in a second, Dr. Nicci Roscoe is a confidence and lifestyle coach and a fitness advocate, and therefore I like her very much. Hello, Nicci.
Hello, Andrew. Good morning. Happy Christmas to you.
And happy Christmas to you as well.
Listening.
You sound very upbeat. Have you been stretching this morning?
Okay, yeah, I've been stretching. I've been for a great walk with my dog already this morning, and I haven't let anything get in the way. Even all the indulgence over Christmas, which I can really understand that everybody does, because, you know, Christmas time is a great time to eat, right?
God, it's everywhere.
It's everywhere. For everybody.
Yeah.
I was listening to what you were saying before. You know, it's your responsibility to take care of yourself. And yes, it is. But sometimes we can find it really challenging because if things aren't going our way, we're not feeling great about ourselves, we're stressed, we've got loads going on at work, so we're sitting at our desk all the time. You know, it is up to us to mentally, and as Dr. Raj was saying, you know, talking about this neurohormone, it is our mindset to have that positive mindset, to not want to have that pain, to want to have the pleasure of feeling good again, to actually go and do something about it.
And yet, Nicci, you know, you eat something. You're in a supermarket. All the chocolates they're at children height and everything else. We keep on stuffing our faces. Ultimately, I'm sorry about this, but this is the way it is. We keep on stuffing our faces, and then a couple of days later, a week, 2 weeks, a month later, you look in the mirror. You don't like what you see, and the whole thing is self-perpetuating.
I agree. I absolutely agree. And what it's all about is choices, and it's the choices that we need to make. I was working with a client, on one-to-one client, and she was lacking energy, feeling really awful and miserable about herself. She was thinking negative thoughts. She was low. She was eating loads of sugary foods. So by changing that, by starting to make choices, by instead of having chocolate bar, to have an apple or to have some carrots and celery and hummus, and I know that might sound boring to people, or a health bar, and to get out there and do some exercise can make such a difference. And it made her feel so much better. But she reached that low point before she wanted to start getting out and doing something.
Are we talking about women here primarily, Dr. Raj, or is this, men as well are developing all sorts of eating disorders which they didn't have in the past? And I know I've gone clinical here, but it has to be said. Is it women that we're still talking about primarily?
No. In this country and in the Western world, the prevalence of obesity, overweight, and obesity is nearly similar for both men and women. The reason we are talking more about women is women seek help, and they seek help for body image issues. That is why it's more, you think it's the women, it's not the women. I sit in a clinic, both in the NHS and private, and see 90% of women who are using the services. There's only 10% men who are either being pushed by the GPs or by their partners. They're not bothered.
No.
Whereas the women are bothered due to body image.
Dr. Raj, thank you. Nicci, I don't understand where physical education has been lost. Is it just about league tables now? Is education just about maths, English and biology? Physical education, the understanding of a body, not just how it works, the biology of it, but the actual functioning of your own body. We have become divorced from our own bodies.
Yeah, I do believe that people are going into schools, in fact I have done myself, to go and talk to children of all ages and teenagers, to talk to them about the importance of exercise and doing more and eating a lot better. But I do think that, yes, we have become a lot more sedentary in this country. People have relaxed on the exercise. They are eating more. The children really need to see and hear more about eating healthily and to have those choices even more that they're doing now, because rather than coming home and having chips, to have something completely different.
Yeah,
to
completely.
have a baked potato, to have more vegetables, to be encouraged not to eat so many sugary snacks.
That's boring though, Nicci.
It is, but it can be made to be a bit more exciting. You know, I remember with my own children that I used to give them fruit platters, and on the with the fruit platters, they'd have different kinds of dips that were indulging, that they used to enjoy as well. You know, a little bit of something in moderation is okay, but to have the healthy snacks as well, I think is really important. And I also believe that getting our children out there to exercise as well, getting them into doing regular walks, being healthy, running up and down the stairs, using tiny little hand weights, having fun with balls, you know, getting outside, because there's so much going on with, you know, that they can just sit at the computer, they can watch TV.
No, but they might cut their knee or something, Nicci. We can't have that. Listen, I want you to have a great day. Thanks for getting the conversation going. I think it's a very important subject. Dr. Raj, you're probably jolly expensive, but you're probably very, very busy as well, aren't you? This is, as I say, a very big subject. No pun.
Absolutely, yeah. It's causing huge impact. My worry is in the next 20 to 30 years, what we are talking about, the middle-age group are going to be elderly, and you're going to have a sick elderly population stretching out already stretched healthcare resources. That is my biggest worry.
Dr. Chinadore Raj, talking about exercise, talking about obesity, and talking about the connection between our physical selves and our mental health. We're talking about endorphins, about feeling good. We're talking about understanding your strengths and your weaknesses. And what do we do about it in school? Virtually nothing. PE teachers go absolutely mad trying to get physical education further up the agenda. I think that's one area that we should address as we look at the headline in the Times today. Middle-aged in denial over alcohol and weight. No question about that. And I will tell you in just a couple of minutes' time, how much exercise do Public Health England advise that we should take in order to remain healthy? I think you'll be surprised.